Hello everybody. Thank you that you are interested in orthodontics and that you found my channel to watch my videos. Alright, the topic here is orthodontics. With this video I want to give you an introduction, a survey over the videos that I produced to cover the question, why orthodontics? So why should you listen to me? Well, I'm just over 60 now and thus I can look back to a certain amount of experience. And I am having a dual career, which means I have a background as an anatomist and also I am an orthodontist. I'm interested in the face. For almost 30 years I have been director of the Department of Craniofacial Developmental Biology at Charité Universitätsmedizin in Berlin in Germany. And there, with more than 50 graduate students, we could work on basic research on how the facial components develop and how they are structured. And also, for about 35 years now, I have been seeing patients as an orthodontist. In finding the correct diagnosis and in search for the most appropriate treatment, I feel that my background in structural biology has been very helpful for me and for the patients. And furthermore, I have the honor of being the president of the Eurasian Association of Orthodontists. So now it's time to give you a brief overview of the topics I want to share with you. I suppose you are people who care about their faces, their physical appearance, and how you are constantly interacting with those around you. I do not address you as experts. Instead, these videos are meant for anybody who is interested to get a certain background knowledge about why orthodontics is important. That's why I did choose the title, Why Orthodontics? Many people think orthodontic treatment may be nice to have, but it's possibly not substantial nor sustaining, and it's only important for aesthetics, for having a nicer smile. Well, you will see. Here are the topics that I will address. So at first, it is not about smile and beauty, but about the position of the teeth in interaction with the position of the jaws and the muscles and the temporomandibular joint. If there is something wrong, it may cause problems and severe pain for some patients. And the second video shows how the teeth are supported by bone. We want to make sure that the teeth are always well surrounded by bone. We cannot move any teeth without proper diagnostics about the bony situation. We will never move the teeth out of their bony embrasure. And only then we will address another goal that we have, a beautiful smile. This is actually a side effect that you get for free when we align the teeth physiologically correctly. A beautiful smile makes you appear more friendly, even more intelligent, as shown by psychological studies. In this way, orthodontics can be a very significant contribution to your success and happiness in life. But orthodontics is more than just making teeth straight. It's about growth of the face. After all, the teeth are sitting in the jawbones, and if they grow away, then the dental arches cannot fit together. And the development of the dentition is complicated. It can sometimes get quite tight for some teeth. We can correct it then. And just like you, we want treatment times be as short as possible. However, the best time for treatment and the speed of tooth movement are dictated by biology. Growth of the face often has a different rhythm than the development of the teeth and the dentition. And what is almost most important, teeth are never stable by themselves. They can migrate for a lifetime. And this is why we need to hold them in place after successful orthodontic treatment. Unfortunately, this is underestimated by so many people. And I'm happy and grateful that I can also apply my knowledge to musicians' medicine. Here I show why orthodontics is of particular importance also there. As you will see, I will not have the appliances themselves so much in the foreground. As technology changes, they are also prone to change over time. And also, the selection of treatment technique depends so much on the training and on the preferences of your orthodontist. I don't even want to talk into that. My main focus is to explain the biological and the medical background. Now, it depends on the insight and in the ingenuity, the fantasy of your orthodontist, how to find the best treatment solution for you. And also, I will not address the long-lasting and complicated treatment of patients with cleft lips and palate. Treatment of these patients is an important part in orthodontics, but fortunately, the prevalence is low enough that I thought I should not include them here. So in this series of videos, you will hopefully get an insight into why orthodontics is beneficial, well, even necessary if you want to keep your teeth for life. We work together with your dentist for achieving that aim. It is my very personal view about what I've learned over the years as an orthodontist and as an anatomist. I hope it is helpful for you also to get an insight into why orthodontics.